Hi, my name is Kimberly Kuda. This is my presentation on Feel the Stretch and lengthening techniques. First, what are lengthening techniques? Lengthening techniques are used to improve an athlete or client's range of motion, to increase their elasticity or flexibility in certain short and overactive muscles. This is going to be very individual to the athlete. It is not a one-size-fits-all. The two most common lengthening techniques. The first one I will be discussing is static stretching. Static stretching focuses on mechanical and neural adaptations, and it will increase flexibility and range of motion, although there are other stretching methods that will do this better. The best time to perform static stretching is going to be after practice or after competition. Some of the pros is going to be, again, that gain flexibility. Yes, it is going to improve an athlete's range of motion. And one of the huge things, it can be performed easily on their own. So you can prescribe a client and or athlete with sets of stretches to perform post-workout, and they will be able to easily do those exercises. The con, recent research is starting to show that static stretching prior to competition or even high-intensity athletic workouts, it has been shown to decrease sports performance. With that being said, that's why I say it's best done post. Are you able to do this pre? Yes. Again, if a athlete is complaining of very specific overactive or short muscles, I recommend that the athlete focus on stretching those prior to doing a whole body stretching routine prior to your competition and or a high intensity workout. The next one is PMF, and the focus is going to be on autogenic and reciprocal inhibition. Again, just like static stretching, it will increase flexibility and range of motion. The pro is going to be increase that flexibility. It has lots of statistics and research being done that it does improve range of motion better than static stretching. And it also does a great job at reducing the effects of delayed onset muscle soreness. Again, that is going to do that better than static stretching as well. One of the big cons of PMF stretching is the need for an athletic professional to perform some of the PMF stretches. Yes, there'll be ones that you can prescribe or have the athlete do on their own, but yet there are a handful and many that they will not be able to obtain on their own. Again, both of these sets of stretches, I do recommend doing post exercise rather than pre. And they both have their pros and their cons. So this is going to be very individual and specific to the athlete or client you are working with on what the best implementation will be for them. Here are a list of the references I use. Thank you for listening to my presentation.